Start each day at 4 p.m., but earlier today the boss called and she said that she's going to kick us off tonight.
Well, first, a huge thanks to all of you for being amazing members of Team Kentucky. In the past few months, we have been asked to step up to face numerous challenges in the face of COVID-19. You have shown that time and time again, Kentuckians are resilient. We are strong, but we are stronger when we work together and look out for one another. So I thank you for all that you have done to rise to the occasion and to keep yourselves, your families, and your neighbors safe during these unprecedented times. And with that, I'm so excited I get to ask Virginia to say to all of us out there, we will get through this. We will get through this together. Thank you, Virginia. Andy and Jacqueline have called upon you many times in the past few months to help those in need. Today, I ask for your help as we seek to support Kentucky students, educators, and staff. We are seeing rising numbers of COVID-19 cases in our children. As a parent, this is frightening, and I know you all feel the same. I know our teachers, faculty, and staff are worried about safety precautions too. This is something Andy and Lieutenant Governor Jacqueline Coleman discuss daily. And because of these concerns, it's more important than ever that we are proactive in preparing our schools for a safe return when that time eventually comes. Guidelines state that staff and all students in first grade and above are required to wear a mask to school unless they have a medical condition that otherwise prohibits them. While wearing a mask is one of the best ways to stop the spread of COVID-19, there are circumstances where obtaining a mask may not be possible for everyone. This pandemic has impacted so many Kentucky families, and we must try to reduce additional barriers to keeping our kids safe. That is why I am so excited to announce that I have teamed up with Lieutenant Governor Jacqueline Coleman to launch the Coverings for Kids initiative. We are seeking to collect mask donations, homemade or otherwise, to provide to Kentucky schools for students, educators, and staff at no cost to the school districts. These donations will help our schools and students be healthy and help ease the additional stress that some face during this time. And I'll note, although the name is Covering for Kids, we are hoping donations will include both child-sized coverings as well as adult for older students, teachers, and other staff members. And I'm a little disappointed that James is on the ball with this with the slides, because I've always wanted to say, next slide, Kenneth. But thank you, James, for having us ready to go. If you visit the link on the screen here, you will find more information on how to donate, as well as resources, mask-making tutorials, and guidelines for donation requirements. We have asked a lot of our schools, educators, and students in the past few months. Through Coverings for Kids, we have an amazing opportunity to come together once again as Team Kentucky and help the children and educators of our Commonwealth stay safe when they return to their classrooms. Even though that date is currently delayed, we must be proactive versus reactive, which is why we are coming to you now to ask for your help. I encourage you to donate if you can, and I look forward to working together in this effort. Thank you.
The First Lady shows up, and for the first time, the slide is ready on time. So once again, we know who's in charge. Yesterday, we talked about new testing opportunities, specifically in Louisville and in northern Kentucky. I wanted to make sure that we provided some updated information on each so that people could get signed up. With us being at a time where we have had more cases than really ever before, though we certainly hope leveling out, we want to make sure that everyone out there can get a test. Yesterday we talked about there being over 200 active testing locations in Kentucky, but also talked about what we were going to do to replace those Kroger drive-through testing. So first, if we can show the St. Elizabeth. These are our Northern Kentucky drive-through or drive-up testing. People can start signing up the afternoon of August the 5th for the Erlanger testing, which will open on August the 6th. On these slides and on our website are the website, the link to sign up. You do need an appointment. And then starting Tuesday, August 11th, there's going to be a second option in Northern Kentucky in Alexandria. Want to make sure that everybody uses both of those opportunities. Obviously, our Northern Kentucky counties have been hit especially hard, and we want to make sure that we have enough testing for everybody who needs it. In replacing our Louisville Kroger drive-through testing, we have now a number of different options. First, the U of L testing locations are taking reservations for appointments right now. This is one where you have to call the line 502-588-0414 to sign up. They begin August the 6th, but you can start calling now to make sure you get your spot in line at any of those 3 locations. Again, we want to make sure that they are fully used. Last one we didn't talk about yesterday, but is another partnership that we are now actively engaged in. As you know, Norton Healthcare has been a hero in the fight against COVID, like all of our major hospital systems. They had been having significant issues getting testing supplies, which we're starting to see around the country. We as the state were able to team up with them to make sure that we could still offer community testing. So this is active right now. You get an appointment tomorrow if they're available. You can schedule these online at nortonhealthcare.com/RITC or at 502-861-4611 with option 1. So while we are still in this transition, we're going to come out of it with more options, more tests, more capacity than we had before. We will be making an announcement here soon about our replacement in Lexington. It looks like we may get some additional help from Kroger to bridge that gap. Our partner there is most likely going to be the University of Kentucky, but right now they are testing 30,000 students. We'll start seeing that data come in our overall state data. So again, we hope this week that we continue to see the trend we think we have the last couple weeks, which is a slow of the growth that we have seen. Last week we showed a graph of how we have moved from week over week increases of 40+% and 50+% down to 4 or 5%. And while today we have a higher number than we had at this time last week, if you compare Monday and Tuesday of last week, it's just barely higher than Monday and Tuesday of this week. So again, what we believe we see is a general leveling off, though today there are more cases than I would like to report. Today we're reporting 700 new positive cases of COVID-19. Again, though, if you add yesterday and today, Monday and Tuesday of this week, it's about 20 or so overall positive cases lower than Monday or Tuesday of last week. We just had one big day and one relatively small day. It's out of 7,516 new tests, which bring us up to 650,093 total tests to date. It brings our total number of cases to 32,197. 30,238 are lab confirmed. The others are probable. We talked a little bit about duplicates and why they are removed, to make sure you don't have someone getting 2 tests at different times. We removed 11 duplicates from yesterday's numbers that are reflected in today's. We have 638 Kentuckians in the hospital right now for COVID-19 and 135 in the ICU. Our positivity rate today is up just a little bit. It's about 6/100ths higher, 5.24%. We don't like to see that climbing up. It is not significantly higher than it was yesterday, but we do want to start seeing this get closer to that overall 5%. We are pleased, if you can be pleased in the middle of COVID, that this isn't increasing at the rate that we previously saw, where we went from 2.5% to 5.5% over those period of weeks. We are holding relatively steady in that area. At some point, we all want to see it go down because we have too many cases right now, and certainly a positivity rate that is higher than we want it to be. Again, we're seeing more cases of young children, 18 kids under 5 years old today. And Brittany and I know as parents how scary it must be. We actually took our kids to get tested today, and they were negative, and we are thankful and grateful for that. But as parents, our hearts go out, even if a child is asymptomatic in this instance, that the worry that any parent must feel. Youngest today is 2 months old. All different counties: Meade, Scott, Jefferson, Mercer, Hart, Laurel, Grant, Davis. We even have some siblings that are both positive in here. Let's make sure that we're protecting our kids. And I don't know if there can be a better reason to wear one of these than to protect your own children. And we're keeping a close eye on the number of children that are infected, which certainly complicates how and when we ultimately get back to in-person classes. Today we've also lost 7 additional Kentuckians. That's 7 more than we ever want to lose, but let me again warn that this is probably going to be a really tough month as far as our losses in Kentucky. Losses trail number of cases, typically 2+ weeks, a month, and we've had a lot of cases in July. It's probably going to be a really hard August. That doesn't mean that we don't think that we are, through wearing facial coverings, getting this under control. We believe that we are stabilizing where we are. We want to see it decrease. But that doesn't mean that we still aren't going to go through the loss that's caused by that previous escalation of cases. So let's make sure that we have those green lights on and are ringing our bells at 10 a.m. because there's going to be a lot of families this month that need our help. Today's losses include a 45-year-old woman from Jefferson County. I know there's some comorbidities there, but as a guy that's 42, that ought to be a wake-up call for all of us. 81-year-old man from Jefferson, 70-year-old man from Davis, 95-year-old woman from Ohio, 69-year-old woman from Jefferson, and then a 53-year-old man from Callaway and a 50-year-old man from Kenton. And it's compared to just about every day that I have read these. This is one of the youngest groups that I've had to read, and that's what they're seeing in some other states too. In this wider spread escalation, we're unfortunately losing not just more people ultimately, but from a wider range of ages. Our racial and ethnic data is virtually the same as yesterday. It will be on the website. We update it every day so that we can be fully transparent with that data and show the disparities that it hasn't uncovered. We knew they were there, but it certainly laid them bare. Long-term care facilities. This is our second day of trying to show this in a way that separates the cumulative, the total since the beginning, with the active cases. So today we have 13 additional residents in the active cases, 25 additional staff, and 3 additional deaths, all attributable to residents. 5 additional facilities have at least 1 case related to them. We're going to have an update either tomorrow or Thursday on long-term care. Secretary Freelander will give that, and these numbers are tough, but what he'll be able to show you is that we're in either the middle of the pack or performing better than most states in protecting our seniors. And I know what we're doing right now as far as regular testing of staff is now considered to be the way that we keep COVID-19 out of these facilities. Just like we're seeing more kids getting COVID, we're also seeing more of a spread in our child care facilities. Today we got 6 new facilities that have at least 1 case associated with them, 2 new staff members and 4 new children, and that's just since yesterday. So that's something we are, again, going to keep a close eye on. So a tougher day in terms of overall numbers, certainly as compared to yesterday. It's brought our total death count higher than we had ever wanted. Now up to 751. Over 750 Kentuckians lost. We'll put that in perspective later this week, but we're getting close to the number of Kentuckians lost in some of the major conflicts that we've had, at least in the recent past. This is a devastating virus. It's one that we've got to battle against. But we know how. Just because today has a high number of cases, again, when you compare Monday and Tuesday of last week and in this week, it looks like in the very least we are slowing down what we were seeing, which ought to prevent us from being a Florida and Arizona or one of the states that are going in that direction. And this, let's turn it the right way up, is the major reason why. We can now show you, and we showed in that graph, can you put that back up? Yesterday, where we were heading, but for our willingness to wear a mask or a facial covering. The curve that we were on was troubling, but now, thankfully, we are headed in a better direction. We want to see that curve flatten out even more. But where we would be today is where Oklahoma was a week ago, with 1,000 cases plus every day. And thank goodness we're not there. The reason we're not there is because Kentuckians are working so hard and doing such a good job wearing these facial coverings. And I and this entire Commonwealth are very proud and very grateful for what we're doing. When you wear a facial covering, when you're in public, you're passing the test of humanity. You are living your faith. You are showing that you're going to treat your neighbor as yourself. You're putting other people's lives above your basic comfort. And I'd like to think that's a very small sacrifice that we should all be willing to make. So I want to look at a few examples of people following Mask Up Kentucky. So this is the Wolf Prescription Center in Campton. And this slide is a trifecta. If you look really closely, we have facial coverings, we have gloves, and we have different sanitation, both wipes and disinfectant, if you look close enough in here. This is a center doing it right, and we appreciate all of the staff there. Now we've got this kiddo. This is pretty special, posted by his parents. This is a child that has asthma, but still knows that wearing a mask and doing it safely, having his parents around to monitor, protects him and protects others. This is an example of somebody who needs us to wear the mask for their own health. And look at him, he's doing it too. And again, like my dog, his dog still recognizes him. Your best friend still loves you. That's got to say something. Next one is from the Masonic homes here in Kentucky. Again, doing everything to keep our grandparents, and maybe this is even this is a daughter and granddaughter, making sure that we are still reaching out to those that we love, especially those that are more isolated, but keeping those that are in our long-term care facilities as safe as we can. And finally, this could be our new spokesperson for Mask Up Kentucky. If you can not only get yourself out there showing the importance of wearing a mask, but you can get that pup in one, I think you will not only break the internet, but you will be highly encouraging to all of those around. And while that's fun, and this is all fun, these are people doing the right thing. So please, do the right thing. Mask Up Kentucky. It is a small thing we can do to save lives, to protect our economy, and to get our kids back in school. All right, we're moving fast today. Brittany said that we had to go less than the whole hour, and I'm doing my best to fall in line. So we got almost a full house today. We'll start, if we can, over here with Catherine.
Now that it's been about a week that bars have been closed and restaurants have been at reduced capacity, do you feel confident that at the end of that 2 weeks you'll be able to lift those restrictions?
The question is, am I confident now it's been a week with restaurants at a lower capacity and bars being closed that we'll be able to lift the restrictions a week from now? We're certainly seeing a leveling. I think that's due to the facial coverings. I don't think we see in the data the impact yet. It's my hope that next week we'll be able to lift those restrictions. Now for bars, it's going to have to look different. We're trying to work through some new ideas right now. Would I like to see a break in the data during the course of this week to feel more comfortable with it? Yes. This is it's a big sacrifice. Certainly our hope is on the restaurant side, and we'll be able to increase that capacity. We have some business and arts organization asking if there are some instances where face shields could be used instead of masks. That answer is yes. In appropriate circumstance, a face shield can be useful, and I'd ask people to use their discretion on it. And certainly if you have any respiratory issues that make wearing a mask difficult, wear that face shield. It's going to protect you, at least from the droplets, and protect you from spreading those to others. Nick, I did not realize that your wife is an ICU nurse. So thank her from all of us.
Thank you, Governor. Appreciate it. Question in terms of schools restarting. This is a question I asked you really just a couple weeks ago. We're seeing more and more schools that are starting through online services. Are you surprised in that? And I mean, what's your thoughts?
The next question is, am I surprised that more and more schools are starting online? No, I'm not. Right now, we still have a very high rate of cases in Kentucky. While we believe we have stopped what could have been a very severe escalation, it's still concerning with the number of cases that we see and the age group that they reflect, how we see clusters breaking out. I hope to see a decrease as we move through this week, but I think all schools ought to be looking very carefully at this data. And if they believe it's in their best interest, the best interest of their kids and the best interest of their teachers to give it a little more time, I certainly understand that. And I want to be supportive of those superintendents who make that decision that they need a few more weeks or that they're going to start with an online platform. And if we get closer to that third week of August and we are seeing an escalation or not what we consider better control, it's hard to say control, but better control, then we may have further recommendations there. You may have seen that the Indianapolis 500 has reversed an earlier decision and will be run without spectators. With the Kentucky Derby a month away, can you provide an update on your position on allowing thousands to gather at Churchill Downs? I talked to Bill Carstangen, who heads Churchill Downs, earlier today. We are both carefully watching the numbers. He assured me that he wants Churchill and the Derby to be safe. We're going to talk early next week after we see the trends going on this week, but their commitment is to do what it takes to make it safe, and we're going to make that. We're going to talk about that with the best data that we have by early next week. I do want to say he reached out to us, not the other way around. We would have reached out at the right time, but that was them being proactive. Chris?
This has to do with what's coming up in November. The working group for the Kentucky Board of Elections sent you their recommendations on Friday. I've been given a list I'll be reporting on at 5:30 about what are some of those possibilities. Where are you at with your negotiations with the Secretary of State on preparing for November? And what do you see as the changes that you can anticipate for November 3rd?
A question is about a working group that has been come together and has now made recommendations for the elections, the general election coming up in November, and where the state, where we are between the Secretary of State and myself on agreeing in an overall plan. We have received those recommendations. The Secretary of State is now working on his formal recommendation to me. I'm told that I'm going to get that at the end of this week or early next week. I'll want to review that for a day or over the weekend if it's on Friday, and meet with them as early as possible to begin those discussions. My position's pretty clear. We had one of the best turnouts ever for a primary during this last primary election, and we shouldn't move backwards from there. We need no excuse absentee voting. That is necessary when you have a worldwide health pandemic out there, and we see the type of participation that we had. Now, I believe that there may need to be a discussion based on how many people will vote that way on extra man or woman power for the clerks to calculate them, or a potential cutoff period of when you have to get them in earlier than last time if there is longer early voting. The recommendations have more early voting. I think that's good. We do probably need to promote it more than we did in the primary election. In the primary election, we had early voting. We had very few people coming in the days before leading up to it. That's something we can do better on. We're going to need more polling locations in our major metropolitan areas. That's something we can all agree that we need to improve on. But I want to make sure we have significant absentee voting. We need more polling locations and early voting.
Can it be safe and can it be fraud-free doing it with these recommendations?
Yes, it can be safe. It can be as safe as an election can be in the midst of COVID-19. And we've got to reduce the number of people who will come to the polling locations to make that safer. At the same time, there are some that won't have the means to vote by absentee, so we've got to make sure that we enfranchise everybody, that we have the largest turnout that we possibly can, and I believe that, yes, it is fraud-free. I was Attorney General for 4 years. We saw very few examples of the types of fraud that people raise concerns about that would impact this election. Tom.
You haven't mentioned your quarantine today, so I'll mention it today.
Let's put it up. Hey, it's a great question. It's about where not to travel.
But anyway, while he's looking for the slide, you have that in effect if you go to these certain states, and there they are. We've got the street rods in Louisville this weekend, the people who are bringing their street rods in from those states.
The question is on with an event going on at the fairgrounds in Louisville with people coming in from out of state. When we're asking our folks to quarantine when they go to these states, what about the folks coming in? Obviously, this is an advisory instead of a mandate based on a lawsuit from several months ago. We cannot put out a mandate, at least under one reading of that. So this is us asking Kentuckians to do the right thing. For those coming in from out of state, if they're coming from any of these places, they really need to get tested before they leave. Don't travel from any state to any other state. That doesn't have to be just here in Kentucky and bring a virus. Make sure if you're going to travel and you're going to be at somewhere where you're around people that you have gotten tested. That's your responsibility as a human being, and that's your patriotic duty as an American. The other thing is wear that mask and separate 6 feet. Now, if we're going to be able to do these things like this event, the Hot Rod event, then we've got to make sure that the rules are followed. It's primarily outside, which is good, but we're going to need to make sure we see people wearing facial coverings, and in Kentucky it's required. If you're within 6 feet, just because you come in from another state that might not have that requirement, you got to do it here.
Going to the Coverings for Kids initiative, what else is the state doing to help school districts protect their teachers, protect students in regards to PPE and things like that they'll need if and when we get to in-person learning at some point?
The question is, what is the state doing to help school districts to be safe, PPE and other areas? We're doing a couple of things. Number one, for the general population, which includes parents and school children, we've distributed tens of thousands of masks through, especially the Kroger drive-through locations. Those have been made by some of our incarcerated Kentuckians that are helping out during this virus by doing it. Second piece is we've put out different guidelines to try to help our school districts be as safe as they possibly can. And we're always working to update those, also having regular calls with either local health departments, which are working with them, or others. We are working with one individual school district, and we'll see the type of participation we can do to try to do a pilot project on testing of teachers. Try to see what that would look like as people are going back into school, and what, at least in one community, we would see about who might or might not be infected that would show up on day one. We're certainly supportive of additional CARES Act funding for our school systems to make sure that we can keep them safe. What we're also working on for our school districts is pushing Congress for budget stabilization, without which schools might have money to buy PPE, but they won't have the amount of funding in the next budget they need just to keep the doors open. I think we'll have an announcement on that here soon. Lawrence?
Back to Derby, especially in light of the Indian 500 nursing course. Are you comfortable, I'll let you know now, are you comfortable with the Derby having people on the track, especially considering there are things in the
The question is based on the Indianapolis 500. Am I comfortable right now with the race itself? Lawrence, tell me the last part of that question. Just so am I comfortable with having a crowd at the Derby? If it were today, I would want to see some changes made to the plan. If it were today, I'd want to see the crowd thinned out, and I'd want to see significant enforcement. I know we talk about Lynn Family Stadium a lot, but it's a good example of enforcement, where when they get to a certain percentage of capacity and they have people walking the entire time, and it's not even a one strike and you're out, what we see is these events being able to be done and done safely. But I think if it were today, we'd want to see some changes, and I think Churchill Downs would too. What we do want to see is where we are a week from now. But do I believe that if done right, there can be some fans, then yes, I do think that there can be some. And the level will really depend on where we are with the virus, and then the plan. I mean, it's a huge complex to spread them out. We'd look at capacity changes, probably number of people and where they are. And I think those are all things that Churchill is ready to talk about when and if we get to that point. Debbie?
On testing, there continue to be significant delays in getting results, like a week to 12 and 14 days. Can you speak to that? What can be done about that?
The question is on testing, and there being significant delays. So we deal now with, I think, over 50 separate labs that are providing tests. They don't do the testing itself. They provide the kit, and then they run the test itself. They don't do the swab, but they put it through the process. And the challenge with any of that is to be able to monitor the turnaround time for each individual one at any given moment. A lot of this comes from one national lab, which is Quest, which I believe is the largest. It, or LabCorp, is the largest, that right now has a significant, and I think it's an inexcusable turnaround time. And they have large contracts with big healthcare groups that are out there. From what we see, the in-state groups, the Gravities, the Blue Waters, and the Solaris, still have turnaround times that are acceptable, typically 48 hours. And then you have some places that have the rapid tests, of course, that are 20 minutes. We're now living in a time where there are so many different types of tests that people probably ought to really think about which one they want to get. Obviously, some of the rapid tests aren't as accurate as some of the others, but we got to get it all down. If you can't get it really within 72 hours, it's not as helpful as it needs to be. Now, I was talking through with folks that I know that had to go get tests today, the when you should get tested and how you should treat it afterwards. These were some folks that had been in contact or around somebody that had been positive. They went and got tested. They were negative, but there hadn't been that many days that had passed since then. And so, knowing that it can take a certain number of days to manifest, they're still going to quarantine for 3 or 4 days and then get another test to ensure that they're still negative. So we need people to be thoughtful, to listen to that provider when they get the results, and they need to get the results timely. It's a national problem, and we need to fix it. We need to fix it. Catherine.
On the travel advisory, I've heard some confusion from people about whether it's necessary to self-quarantine for 14 days if you have a negative test result upon returning. Can you clarify that?
So in the travel advisory, which is again something we're asking, if somebody is returned, the question is, what if they have a negative test? First, thank you for going to get a test if you've been in any of these places. The challenge is if you just get it the day you get back. You could have been infected in the last 3 days, maybe even 4 days, that you're at a place that has such a high rate, and it hasn't manifested yet in a way that the test will pick up. And so if people are going to go get tested, again, I'd ask when you get back, give it about 4 days, if you will. Get that test, and if it's negative, listen, you've done a lot more than many people are. We would ask that people who can to do the 14 days, but let me be clear on the ask. Don't go to these places. I mean, unless you absolutely have to go for some critical need, don't go to them. And right now, it puts your family at risk, and it puts the people around you at risk. All right, I got a question from WFPL that says 6 states, including Ohio, have joined a regional purchasing compact to buy coronavirus tests. Has Kentucky been a part of that conversation? And we consider joining the compact. We weren't approached in this specific compact. Currently, Kentucky is still able, at least as a state, to purchase the capacity of tests that we need. In fact, we have access to a significant amount of capacity, and that is a homegrown success story here. It is about 4 Kentucky businesses that have been able to get up and running and now provide significant amounts of testing, and that supplements our 2 universities. Our bigger challenges are, number one, getting folks to be tested and getting folks to be tested all around the state, not just in our urban areas. And the second piece is the administration of the tests. You need the healthcare professionals, you need the PPE, but more than that, you got to capture people's data to be able to make sure you can contact them and then provide the type of advice depending on their situation. So those are a few of our challenges. Those were ones we faced as we transitioned from Kroger to U of L to UK and to other testing partners. Nick?
Speaking with some teachers in smaller communities who tell me that they're cool with going back to school, but they do want to know if the state has a plan for if an outbreak were to happen, and is that already being sculpted?
So the question is some teachers from smaller communities, they're good with going back to school, but want to know if the state has a plan for what happens if there is an outbreak. Let me first address the first piece of that. I want everybody to know what's going on in their community, to stay apprised of it. We should know that every school is like a living organism, and that you have certainly teachers, employees that come in from different counties and different regions. You got vendors that come in from different places, those that stock the cafeteria and other needs that a school has, and to look and think about all of that when considering where the region may be or the individual school may be in terms of the COVID outbreak. When an outbreak occurs, the local health department immediately comes in. It's what they've been doing in all clusters all around. And then it's really a very fact-intensive analysis. Just because you have one case doesn't mean a school may have to shut down. It will depend. Has that student, first of all, come to school? How long were they there? Who were they around? If it's a full day and there's been full interaction, it might require an entire school to close. But that's something where they go in, they get the facts, they're in consultation directly with our Department for Public Health, and then we need to be transparent. And the school needs to be transparent, the principal and the superintendent with everybody who works there about what the situation is each time. And it's going to be, when these happen, a school by school, a school district by school district type of analysis. It'll reach us on a statewide basis as opposed to individual school districts. Well, first of all, what we see where the numbers are. Now, I made the recommendation to push back in-person classes because we don't like where the numbers are. If there are those schools that decide to go back at a given time, looking at their experience, because it can easily be the experience in another school. We're seeing some outbreaks in Indiana at some of their schools that have opened, but it'll also depend on seeing the models that our schools have developed. If it's every kid being back at the same time in those busy hallways that I went to school in. I went to a school with almost 2,000 students. And in that model, one person who has the virus could shut down the entire school based on that level of contact as you go through. Chris.
I have a question about your graph that shows the flattening of the curve that we talked about last time, the plateauing. Because I just wanted to ask a question, maybe you could clarify something you said. You had mentioned that the mask rule was really what was creating the plateau, but then some would question whether restaurants were really spreading the virus because you can't wear a mask while you're eating in a restaurant, and whether lowering the restaurant is really still needed. If it's the mask that created the plateau, can you loosen up on the restaurant orders?
The question, I think, is it does. The question is based on our graph with us seeing wearing facial coverings having an impact. Is the restrictions are the restrictions on restaurants necessary? We needed not just to stop the escalation of cases that we're seeing, and we hope that the facial coverings are doing that. We need it to ultimately go back down. We don't need to be at a positivity rate of 5.24%. We need to get that below 5. I'd like to get it well below 5. The White House has been very clear, Dr. Birx has been very clear, that to get it below that requires taking this step at least for 2 weeks with restaurants. We have a significant number of clusters that have occurred in restaurants, so we do have data. At one point it was 18+% of all of our clusters that it can spread in a restaurant. Now, you certainly reduce the potential spread if everyone wears a mask unless they're eating or drinking. In other words, when you're waiting to get in, when you're seated at the table, just trying to do a little bit more. I think this gives our restaurants a better opportunity to prepare. Again, listen, I think they're trying, and it's not fair that they have to bear a lot of the brunt of this, but what the White House is saying is that this can make the biggest impact on getting our cases back under control, and we hope we don't have to do it again. Tom?
Governor, what's the status of that federal lawsuit in northern Kentucky that was undergoing mediation?
The question is on the federal lawsuit in northern Kentucky that is on evictions. It is in mediation. We had a long mediation day on Friday. It is continuing today. I believe our lawyers are on a call with the federal magistrate as we speak. The Supreme Court is also playing a role in those. I think there have been productive discussions. I don't think that there is a full resolution at this point yet. The question is whether we intend on extending the facial covering mandate. I think people should expect for us to do it. It is making a big difference. And I think we can all agree that when we ask nicely, and even when you out there asked other people nicely to put these on, it didn't work. It didn't happen at the level we need to. Allowing our retailers to have a very simple no shirt, no shoes, no mask, no service rule has really improved our overall health, and you can see it in our numbers. We're going to need facial coverings. It doesn't mean we'll necessarily need a mandate, but we'll need facial coverings for as long as we are dealing with this virus. But here's the good news. If they work as well as we think we're going to show that they work, we're going to be able to get back to doing a whole lot of things that we have missed. Lawrence. I'd need to look at the Derby plan. It was a very specific plan. We can get you a copy of it. It's an open record. I believe their capacities are different. This is for Derby, based on the areas of the facility. Debbie, finish this up.
You talk about the need for package brings deadlock in Washington, do you have any thoughts about that? Or are you doing
The question is on a deadlock in Washington, D.C. on the newest version, well, we hope a new version of a CARES Act. You have the HEROES Act, which House Democrats passed, and then you have the HEALS Act, which Senate Republicans passed. And I believe that they're engaged in negotiations. It shouldn't be this hard. I get that things are really hard in D.C. Everything seems hard in D.C. But we're in the middle of an international health pandemic where people are dying, where it is out of control in so many states, where we are much higher than I want us to be, where we are in the midst of a significant recession because of it. And this act, what they pass, may be the difference in us being in the midst of this recession for a long time or us being able to bounce back. This act is going to determine the amount of education funding and healthcare funding that we have. You know, we're looking at the largest single-year budget cuts in the history of Kentucky in the midst of coronavirus. Congress can't let that happen. That is malpractice. That is refusing to step up and do your duty. And again, I guess horse trading occurs all the time in D.C., but I wish we were at a place where at least something like this could shake us out of that and just get us to do the right thing. And what we see is that we as states, and it's all states, are intentionally put between a rock and a hard place. So what they say is, we're not sure that we are going to provide new budget stabilization to the states, but we may give you flexibility to spend the dollars we previously provided to help in your budgets. And then they look at you and say, but you haven't spent enough of that previous money. Well, if you spend it, then you don't have it to stabilize your budget. Their lack of certainty of what they're going to do in this is hurting us in the present and is going to hurt us in the future. This round in D.C. has to include two things, has to. State and local government aid and a continuation of the additional $600 in unemployment. If they change the formula instead of just having that add-on, it will take us more than 45 days to reconfigure our system, and that's everywhere, and people will miss out on benefits during that. And that would be a nightmare, and we are not the only state. That's $600, and I know different folks have some concerns with it. It is of such significant help to our economy right now. It is also going to be a huge difference in how long we want this recession to last. We've got an opportunity in D.C. to do the right thing, and now we just need them to do it. All right, everybody. Monday and Tuesday of this week, at least on average, looks a lot like last week. More cases today than we want to see, and we're going to have a tough month in terms of people we lose. But now is the time where it looks like we can start winning, where we can start getting ahead of this virus. Please, please mask up Kentucky. One of the most important things you can do to protect yourself and protect your kids. Remember, those that get this virus and their bodies can't handle it, those are somebody's parents or grandparents, they're somebody's kids. It's a 45-year-old woman today. Let's make sure we protect one another, and by protecting one another, we protect ourselves. We'll see you tomorrow at 4 p.m. Thanks, everybody.